G'day everyone, Dr. Sherwin here from Artistic Dental Studio with another episode of Dental Tips of the Week, and I'm very excited to let you know that I'm going to talk about dentures today. And as you may know, it's not that popular as compared to the past, but still, because of its obvious advantages, many people like to go for dentures. So what is a denture basically? First of all, let me tell you, when a tooth is lost, it's not just the lost tooth. The surrounding structures, the gum and the jawbone will be gone to some extent. And dentures actually replace all these missing tissues. So there are two main types of dentures, and I'm going to tell you about them. First of all, if the patient has lost their full set of teeth, then basically what we need to make is a full denture. So it replaces all missing teeth and all lost gums, I would say. So that's the complete denture. And the second option we've got is partial dentures. The partial denture means that limited number of teeth are lost. Could vary between one single tooth to like nearly all teeth in one jaw, and it is normally clipped to the neighboring teeth, just like there are some hooks that help us retain this denture in mouth. Well, so what I wanted to talk about today basically was to tell you about the most important pros and cons of dentures. So let's jump in and begin with the pros. The first thing that could be an issue for many of us is the surgery. If you remember, I talked about the first option, which was dental implant, and obviously it needed surgery to be done. With the dentures, normally no surgery is required, so that could be an advantage. Some people do not like, because of their possibly fear or their systemic conditions or whatever, they don't like to go down that path. So denture could be a viable option for them. The second pros could be the time. As you all know now, for implant treatment, we need to wait for a while, depending on the scenario, for the implant to get integrated and get connected to the bone, surrounding bone. But for dentures, normally it's not required. So if the teeth are lost, we can, and the healing period has elapsed, for example, at least 2 to 3 months, then we can straight away go for impressions and make a denture, and it could be done relatively quickly. It could be done if everything is alright and the lab technician is ready to do it quickly. It could be done in a week's time. So that's very quick compared to implants, in which we may wait for a year or so if it needs some grafting surgeries or something like that. And so that could be a factor for many people. Some people like to get to the end point as quickly as possible, so denture could be an option for them. The last, or possibly the most important pros for dentures is the cost. Well, there are no implant components, and the total cost would be much less than implants and also bridges. So when there are some financial constraints, dentures could play a major role. So these are the 3 most important pros of denture treatment. But we need to bear in mind that there are some limitations with this approach. Let's go to the cons now. The first one, being removable. Many people do not like something that you can remove, and they feel old by using such a thing and having to place it in a glass of water while you're asleep. So this is something that mentally could be challenging, and at the same time it could cause some other problems because of being removable, which is the second issue. Well, there could be a lack of retention and function. Many people are not very happy with their dentures because dentures may move while they're talking or while they're eating, because dentures are sitting on tissues which are not designed to bear all those loads. The tissues are compressible. So the dentures wiggle a bit. No matter how well they're made, they could wiggle. Okay, another thing, there is a big limitation with, I would say, majority of our denture patients in terms of what they can eat with dentures. That's another issue. If you're a fan of steak or something quite chewy, crunchy, then dentures may not be the good option for you. So you need to make sure which option you're choosing. It's much easier, but at the same time, it may not satisfy you. The third one, which I think from a dentist point of view is the most important, is that, as I said, because the tissues are not designed to bear all those loads exerted by dentures, over time the jawbone begins to shrink, and as it shrinks, the gum flattens. The more the flattening the gum, the more the movement of denture, the more the sore spots underneath the denture, and the less the satisfaction. So as you can see here, you need to weigh your options and see which one is the best for you. But normally people, as they receive their first denture after the extraction, many of them are quite satisfied for a few years. After that, once this shrinkage happens, the second set of dentures is not as satisfactory as the first one. The third one, obviously not at all. And then there is a dilemma, because why? By that time, they have reached the age of 65, 70, and there are some systemic diseases, some things that could prevent you from getting a better treatment like implant, and you cannot get a good nutrition because you're wearing dentures. So it will be something like a vicious circle. So that's the thing that dentists need to let their patients know, that in a 10 to 15 years time, where the patient will be. And that could be a big dilemma for patients. All right, thank you very much. That was really good. I think I could manage to cover some basic points about dentures, and please share your comments and stick around. We will see you next week with another episode, and enjoy the rest of your day. Thank you very much. Bye.